Hi, everybody. Good afternoon. All right, let's go through some data and then I'll take some questions. No new deaths over the last 24 hours, so really good news there. Looking at tests, we've received 1,862 diagnostic tests back since yesterday. Our 7-day rolling average for diagnostic tests is 0.87. Again, at times our data will be different from New York forward. Think about a college student that is from Onondaga County, lives in another, goes away to college, tests positive. His home address is Onondaga County. That starts out as our case, but then that will get transferred to the county of which they are actually residing and where they're going to be, where their school is essentially. So these things are happening more with college students being back. So data is a little bit different each day. When we look at the reality that now all of our local colleges, our NBT Bank stadium testing, our plan moving forward for proactive testing in schools. All this is done with saliva tests. Over the last 7 days, an additional 7,172 saliva tests have been performed in Onondaga County. When you add in all of the tests, both diagnostic and saliva tests, our 7-day rolling average of positive tests is 0.58. So all the tests in the community, 0.58%. So good numbers overall. We have college back. It's been back. Getting students back in person, learning. Essentially, we would have seen any real upticks from Labor Day weekend. We would have probably seen upticks right now. We haven't really seen anything. We had, an occasional cluster of cases that will drive your data for a couple days. But overall, really in good position. Looking at hospitalization numbers, 10 of our residents are in the hospital related to COVID-19. One of them is in the ICU. Let's keep that person in our thoughts and prayers. 6 Caucasian, 3 African American. One individual has not shared their demographic information with us. Looking at positive cases, 4,093 positive cases since March 16th in Onondaga County. That's 23 new cases since yesterday. Looking at the 23, 1 was travel related. 7 are household contacts. It's kind of a bigger number for household contacts, but that's a reality we know is that if you have COVID, you have loved ones, you don't properly isolate, there's higher risk for people in your household to certainly get the virus. 1 senior facility, 14 community spread, of which 2 are known sources. When we look at out of the 23, 3 out of the 23 are college students or faculty. 6 out of the 23 are school-age children. 5 out of those 6 cases are remote learners, so they are not in buildings. And out of the 5, 3 of them are from the same household. So essentially you had one household where the family came down with the virus. And the one in-school case was the one that was reported on at Fayetteville Manlius, even though that student had not been in school for over a week. So that's a breakdown of the numbers there. Looking at who's been impacted by the virus, 2,343 female, 1,750 male, 415 under 19, 847 in their 20s, 531 in their 30s, 488 in their 40s, 605 in their 50s, 444 in their 60s, 318 in their 70s, 281 in their 80s, and 164 in their 90s. The school testing, I'm going to spend a little bit of time on this because we've, quite frankly, didn't expect this much demand. And so a couple of hiccups that we're working through. But again, I want to thank Upstate Medical for taking this on in partnership with us. The saliva test is a test that parents are more comfortable with having their children participate in. And because of that, we're receiving lots of calls. You could get a diagnostic test done and most likely get the same turn time, but we knew that parents would feel more comfortable bringing their child for a saliva test, and that's holding true. In addition to that, the school districts are learning how to deal with this in the buildings, and as we work through this, we'll all get better at it. But certainly, there are cases with kids that are being sent home for really anything, and that leads to more pressure on the program. So we appreciate everyone's patience with the registration process. I want to just give everybody a couple points here. Upstate is on track to answer 6,000 calls this week. Prior to adding the MBT Bank Stadium site, their average weekly call volume was 1,200. So Upstate's now looking at beefing up the staffing for that, and as well for the demand on the new FDA-approved saliva test. And that's good news because that's going to create jobs here in our own community. But certainly there's other complications with this. Testing minors adds a layer of complexity to obtaining results. Children from 12 to 17 years old have to consent to allow a parent or guardian access to their medical record results. And so we've set up a MyChart account for these kids to be able to go on too. But again, so if we're calling you and your child isn't there for the results, it's a HIPAA violation. So there's all these complexities with this. We understand that people have called and have waited a long time on the phone. They're beefing up that. The reason is because of the demand that we pushed this infrastructure out quickly so we could meet the demand. We just haven't, we did not anticipate how much demand there would be related to this. So we ask you to, again, give us a little bit of time to work out the kinks, but the reality is that there's been over 100 kids tested each day at the site. Good news, Monday through Wednesday, over 350 people tested at the site with the saliva test, no positives. So all these kids had symptoms with something other than COVID. So that is good news. Today, I know we had over 100 appointments at MBT Bank Stadium as well. Want to congratulate, again, Dr. Middleton and their Upstate's partnership with Quadrant Biosciences. Upstate and Quadrant Biosciences are using similar technology that led to the announcement related to the first saliva-based test by FDA approval, but also last year they developed the world's first saliva-based test for autism, all right here in Onondaga County, and certainly it bodes well for our community that they continue to innovate and lead in the pandemic with us. So it's a lot of information that we just gave out related to the virus. Happy to take questions. Yeah, so as far as obtaining results, that's one of the challenges. Normally, if you're under 12, we can call, talk to a parent, give them a verbal, but that doesn't work unless the consent of the 12 to 17-year-old gives us that. If the child gives consent for their parents to get the information, we can. That creates paperwork challenges, right? Data challenges, and that's backed up. That's why we can't have people just showing up at the site as one of the reasons. That's why we need the appointments. But there is a portal. They create a MyChart account that they can go and check the results on. But that's one of some of the questioning and feedback we've gotten. That's one of the things that we've heard, Jim. Others, as I'm calling and I'm waiting, the reason is because it's staffed up for essentially 1,200 calls a week. This week we got 6,000 there. So we just need to, with Upstate, get through this. We didn't anticipate, because these are symptomatic kids, insurance is going to cover this test anywhere. But we knew that saliva would be the preference for these kids, but it seems like every kid, almost every single one of them that's being sent home is coming here. And so that's creating a little bit of a backlog that we need to properly staff up for. We pushed them hard. My emergency management team, I pushed them pretty hard with Upstate to get this done get going, so we had it ready, and we did. And again, we're getting the job done for the most part, but we're building capacity so we can do more per day. The backlogs of call times and wait times are going to get better. Yeah, they're working. Yes, that's one of the things that they're working through now. And again, before when we were doing different testing, mobile testing sites, we had different partners that had different ways to obtain things. And Syracuse Community Health Center, you show up, they have their own process. We're working through all of this test now because they're symptomatic. Upstate can get insurance reimbursement for these tests. So part of that's part of this process too. So we're getting through it. Week one has been successful. Week two will be more successful as we work through some of the procedural issues.
Do you know what the wait times are now to get the test results back?
Well, it's been 24 hours, if not quicker. So again, we know today is Thursday. We know everybody from yesterday, negative. Everybody on Tuesday, Monday, negative too. So the turn times are fantastic, and that's one of the benefits of having this here. Now, the other thing that it's important for parents, and we get it, and the local health departments are pushing this with New York State. Right now, the rule is to get back to school, if you have symptoms, you need a negative test and essentially a doctor's note. These are not the county rules. These are the state rules. We are pushing, and Dr. Gupta has been pushing with her peers, that it's an either or. If you have a child who's asthmatic, they go to their doctor knows them, they say, I'm not going to give them a COVID test because it's asthma. That note, in Dr. Gupta's opinion, should be enough to let them back into school. Right now, that's not the case. So again, that's another step in the process right now that as a community, we just got to get through. We've never been here before. So we're getting here, and so far we've had a pretty successful rollout to schools as well.
Voluntary furloughs, what is the status on that? Do you know how many people have volunteered so far for that?
I think the number's still 11 is my understanding. I haven't heard if there's been any more that have come forward over the past few days that we had. And on a voluntary furlough, we have to agree to the furlough, obviously with the number of people that we no longer have in the building working, over 540 positions that we had filled last year. Sometimes we might not be able to let people take a voluntary furlough because we don't have anyone else to do their job. So this is, that's part of it. I think the first 11 we agreed to, but it really depends on what the person does, and do we have the ability to make up that work now at this point.
How long until you know then who to cut and when is the
cutoff? If you think about when we're looking at right now our workforce, food, shelter, safety is the way we're looking at the departments that we're trying to preserve and make whole. Phase 1 of our adjustments, which led to 86 positions total. Out of the 86 positions, essentially 35 of them came from early retirements. We put that back out there. That helped big time. That those would have been folks that would have been furloughed or laid off. Not the same people, but 35 of their colleagues, right? Because there's seniority. And so that was very helpful. We had about 14 positions that over the last 3-4 weeks had become vacant through normal processes, right? People take other jobs. Then we had 7 layoffs for positions that we just can't afford in 2021. And then we had 19 compulsory furloughs, these are positions we want to bring back in 2021. And then we had 11 voluntary furloughs. So we have made up some of the gap through all these efforts, and now October 6th and the 8th, we get 2 sales tax payments that week. If the sales tax goes in the right direction or stays on our projections, we probably won't make any more moves then. If it goes in the wrong direction, we probably have to do some things.
The shopping town gave 30-day notice to vacant, to tenants to get out of there in 30 days.
Yeah.
What do you have to say?
Yeah, no, look at Shopping Town Mall, Moonbeam, whoever owns it now. They keep on transferring this property to other entities that they own. And everybody that's followed this story knows we took these guys head on. They weren't paying their taxes, refused to invest in the property. Tenant after tenant leaves in a building which is in some of the most affluent suburbs in central New York, yet somehow they can't make it work when there's retail going up all around them. So clearly I'm not a fan. And what we did is we took them into court. We beat them in court. We kept on pushing them. We were going to take the property via back taxes. And then they filed for bankruptcy. So it's in bankruptcy court. The bankruptcy judge has been reviewing the case. They have been making payments to us, $25,000 a month. And I'm surprised by this. One, they never reached out to us about checking their filtration systems in the building. So the building's not even eligible to be open anyways. They've been taking money from these folks. Many of these people have been paying rent. And then they just get a 30-day notice, I think. So I don't know if it's legal, what they're doing. We have our law department looking into it and working with the proper authorities to see if it's even legal within the governor's executive orders. Certainly it makes no sense if you're in bankruptcy court saying, I can't afford all the taxes because I'm not doing well business-wise. So please let me restructure everything and restructure who I owe money to because the expenses are more than my revenue. Well, to then get rid of your revenue, I mean, come on. So these folks, who knows what game they're up to, but we'll push them, and we have pushed them. There'll be resolution at some point on this. Yeah, so they do it at, well, they register the children at the site. That's part of the process when you set the appointment. And then you create this online portal where then the results will go to the portal. And we're looking at ways to further streamline that with staff and calls too. So, but that's the process when they go. They're actually going through a registration process when they show up. And there may be some information taken when they set the appointment as well. But in addition to that, that's why we just can't have people walking up without setting up an appointment. They do. They do call. You call 315-464-2582, and you select option 4. And any child, certainly under 18, must have a adult who can provide consent with them, a parent and or guardian.
How do you think that's helped families and school children in the last week?
Well, I think it's helped 350 of them, essentially get quick tests, and it's going to help more and more. And I think, again, in the beginning of the year, as the medical teams in the buildings are getting used to this and feeling, we're all learning, right? We have our first case, we have our first quarantine. We quarantine probably more kids at the beginning than we probably would 4 months from now, because we're going to learn from it to see if any of the kids had real exposure. At some point, some of these kids, for some of the symptoms, maybe the schools won't be as quick to send them out of the buildings, right? If they're lethargic, they might have been up too late the night before. But we're going to get through that, right? These things are happening. And so overall, it's clear, crisp communication on where these families can go. We just got kind of inundated with more kids being sent home than what we thought was going to happen in week one. So now we have to upgrade the infrastructure, streamline processes. We're working with Upstate to do that.
What have you talked about on the control room calls recently?
Yeah, so still talking and pushing about the infrastructure. I've been told that our saliva data is going to get updated into New York Forward, which is important, because then I don't got to break out all of the testing in the community like we used to have to do before New York Forward, because when people see numbers, there's anxiety with it in this process. So it's important that they see all the numbers and have all of them, not just some of them, right? And so that tells the story. And some days it's a good story. Some days it's a story where you're concerned. Other days it might be a bad story, right? But the numbers are the numbers. But that was important for us, because we're not going to be, all of our testing initiatives are going to be saliva driven going forward. That's going to be what the universities are all doing. So when you have 50% of your tests in your community being done with one type of test, that data needs to be incorporated into the overall data. We've been pushing. We put forward what we thought was a thoughtful process on trying to get the hospitality industry activated more. We've had some conversations with the State Department of Health. Our take is they're probably not going to do anything on that until they got a couple more weeks of school under their belts to see if there's true upticks or clusters that happen from schools.
Does it surprise you that today there were 6 school-aged children cases, when that number seems a lot higher than what we've seen in the past?
No, I mean 3 from one household, right? I think now that people are kids are back to school, parents are more likely to get their kids tested now, or if they're going in to the doctor's office and getting a flu shot, there's a chance that testing will happen. 26% of the cases were asymptomatic, right? So these are out of 23. What is that? 5, 6, 7 cases where they got a test somehow, not because they were sick. And so that might have just been a screening with a college student. It could have been 3 out of the 6 school-age kids too. Went there for something else and got tested for COVID, and they came back asymptomatic. So, that's a part of the population that, again, think about it as a parent. It's tough when you're going to get a strep throat swab done on your kids, right? For me, I got to promise ice cream and all sorts of things. To do these nasal swabs, Trish, parents didn't want to do this. So now they got the saliva test, so parents are more apt to get their kids tested now, and that's a good thing. Remote learners, so they did not have interaction in buildings.
You keep touting these saliva tests. Have you tried it out yourself?
I'm going to. Now, as soon as I have time. I'm going to, and I'll let you know how that goes. But I've seen it, and it looks good. It looks good how they're doing it. So maybe I'll go down with some of the kids one of these days and get one done myself down at MBT Bank.
Did you pay your parking ticket that you had in this amnesty program?
I did. Ironically enough, it had multiple relatives of my name on it, so I don't know if it was mine or a cousin of mine. But I'm not going to throw my cousin under the bus right now, whose name was on it too. But it's paid. It's paid. I made a nice donation to the city of Syracuse. Hopefully that's the last one I'll have to make. Other questions?